Okay, so imagine this. You've got these medical texts describing a guy with a seriously swollen belly.
Sounds intriguing.
Yeah. And your mission, should you choose to accept it, is to figure out what's going on.
I'm in. I love a good medical mystery.
Perfect, because we're diving deep into the world of ascites today. Basically, that's when your belly fills up with fluid and turns out it's like a puzzle.
Ah, so the fluid's a clue.
Exactly. It can point to a bunch of different health issues. Think of it this way. You wouldn't just ignore a flooded basement, right?
You'd want to find the source of the leak for sure.
That's what we're doing with ascites today, figuring out what's causing that flood in the abdomen.
I like that analogy. What's really fascinating about ascites is that it's not a disease in itself. It's more of a symptom, a red flag that something else is going on.
A bit like a check engine light in a car.
Exactly. It could be a liver problem, heart issue, even something with the kidneys. So we got to put on our detective hats and look for other clues to get to the bottom of it.
Okay, so let's get into this case. Our medical texts describe an elderly man who comes in with, yeah, you guessed it, that noticeable belly bulge.
Classic ascites presentation.
Right, but there's more. He's also got these spider naive, those little red spots on the skin, and gynecomastia, which is where men develop breast tissue.
Ah, those details are super important because they give us some early clues about where to focus our investigation. The spider naive, for instance, are often linked to liver issues.
So we're already getting a sense of a possible direction.
Yeah, it's like those early clues in a detective novel that point you towards a suspect.
Okay, so the text also mentions something called shifting dullness.
Ah, the good old shifting dullness test.
Sounds a bit like a fancy medical term. Can you break that down for us?
It's actually a simple technique that doctors use to check for fluid. They basically tap on your belly and listen to the sound. If there's fluid, the sound will change as the fluid moves when you shift positions.
It's like listening for a sloshing sound.
Kind of. Think of it like tapping on a water balloon. The sound changes depending on where you tap.
Okay, that makes sense. It's like a low-tech sonar, right?
Exactly. It's a classic bedside test that's been used for ages to detect ascites.
Now, here's the thing. The texts also make a point of telling us what our guy doesn't have.
Oh, the absence of symptoms, that can be just as revealing as the presence of symptoms.
Right, so he's not showing any signs of brain fog, what they call encephalopathy in the medical world, or any yellowing of the skin and eyes, which is jaundice, right?
Yep. The absence of those symptoms is actually really valuable because it helps us narrow down the possibilities.
So it's like crossing names off our suspect list.
Exactly. For instance, if he had encephalopathy, it could point towards severe liver dysfunction. Since he doesn't, it suggests maybe the liver isn't the primary issue, though we'd still want to investigate it further.
Okay, so it's all about eliminating possibilities, ruling things out.
Exactly. It's like solving a puzzle. Each piece of information, whether it's a symptom that's present or a symptom that's absent, helps us get closer to the solution.
All right, but here's a curveball. What if this man suddenly spikes a fever? The texts make it sound like that changes everything.
Oh, absolutely. A fever is a game changer in this situation. It immediately raises concerns about something called spontaneous bacterial peritonitis, or SBP.
And SBP is?
Basically, it means the fluid in his belly has become infected. That's a serious complication, and we'd need to act fast.
So it's like the flood in his basement has turned toxic.
A very good way to put it.
Wow, okay, that sounds pretty scary.
Yeah.
What would be the first step if that happened?
We'd need to perform an acidic tap, basically using a needle to take a sample of that fluid and analyze it.
Like sending it to the lab?
Exactly. We'd be looking for signs of infection, particularly a high white blood cell count.
So if the white blood cell count is elevated, it's pretty much confirmation of an infection.
It's a strong indicator, yeah. We also look at other things in the fluid, like the protein level and the appearance, to get a complete picture.
So the tap is like sending in a microscopic SWAT team to figure out what's going on.
A good analogy.
Okay, so the tap is crucial, but it's not the only thing, right?
No, it's just the beginning. Think of it like gathering evidence at a crime scene. We need to collect as much information as possible to get a clear picture of what's going on.
So the texts mention a whole bunch of other tests, like blood tests, imaging studies, the whole works.
They want to be thorough. We need to check his liver and kidney function, his blood count, and even look for specific markers, like a protein called AFP.
Hold on, back up a sec. Why AFP? What's so special about that one?
Well, in this case, with all the other signs pointing towards a potential liver issue, we'd want to rule out something called hepatocellular carcinoma.
Uh-oh, that sounds serious.
It's a type of liver cancer. AFP levels can be elevated in people with this type of cancer, so it's a crucial piece of the puzzle. We're not saying he definitely has it, but we have to check.
Makes sense. Better safe than sorry, right. Now, the text also mentioned an endoscopy, which I know is where they put a camera down your throat.
Yes, the endoscopy. Very useful tool.
What would they be looking for with that in this case?
An endoscopy lets us see inside his esophagus and stomach. We'd be checking for signs of portal hypertension.
Okay, remind me what that is again.
Portal hypertension is basically increased pressure in the blood vessels of the liver. This can cause enlarged veins, called varices, in the esophagus and stomach. They can be dangerous because they can rupture and bleed.
So the endoscopy is like a visual inspection to check for those varices.
Exactly. It's an important part of the workup for ascites, especially when we suspect a liver issue.
Okay, so we're connecting the dots between different symptoms and test results. It's starting to feel like a real detective story.
It absolutely is. Medical diagnosis is all about piecing together clues and using logic and knowledge to arrive at the most likely explanation.
Now, before we go any further, let's address the elephant in the room.
The big question mark, I like it.
Statistically speaking, what's the most likely reason for this man's potential liver problems?
Well, in the UK, the most common cause of liver cirrhosis is alcohol consumption.
So alcohol abuse could be a major factor here.
It's definitely a possibility, but remember, we can't jump to conclusions. We need to rule out other potential causes before making any assumptions.
Good point. What about hepatitis? That seems like it could be a concern too.
Absolutely. We'd want to run a hepatitis screen to check for different types of the virus. We'd also want to check his iron levels, copper levels, and get a sense of his family history to see if any genetic factors might be playing a role.
So even though alcohol is statistically the most common cause, we're not ruling anything out.
Exactly. It's important to keep an open mind and consider all the possibilities.
Okay, so we're being thorough and looking at all the angles. Now, the text also go into a lot of detail about analyzing the protein levels in both his blood and that acidic fluid.
Ah, yes. The serum ascites albumin gradient, or SAG for short.
They call it the SAG. Why is this so important? What does it tell us?
It's a really clever way to get more insight into the cause of the ascites. It basically tells us the difference in protein concentration between the blood and the fluid in the abdomen.
So is it like comparing two sides of a scale? What happens if one side's heavier than the other?
That's where it gets interesting. A high gradient, meaning a big difference in protein levels, strongly suggests a liver problem, especially in this case where we already have other signs pointing in that direction.
So a high SAG is like a flashing neon sign pointing to the liver.
Pretty much. In fact, it's considered highly accurate in diagnosing liver cirrhosis, like a fingerprint for the condition.
Wow, that's pretty amazing. But I'm guessing a low gradient points us in a different direction.
You got it. A low gradient suggests the ascites might be caused by something other than a liver problem, things like certain infections, a malignancy, or even inflammation of the pancreas, which is called pancreatitis.
So it helps us branch out our investigation, so to speak.
Exactly. The SAG is like a fork in the road, guiding us down different paths depending on the results.
This is getting pretty complex, but I'm loving it. Okay, so let's say all signs are pointing to the liver. Would our patient automatically need a liver biopsy?
Not necessarily. The texts emphasize a stepwise approach. We'd start with blood tests and potentially a FibroScan, which is a non-invasive way to check for liver stiffness.
So a FibroScan is like a gentle way to feel the liver without going inside.
Exactly. It uses sound waves to measure how stiff the liver is, which can indicate scarring.
Okay, so if those tests strongly suggest cirrhosis, we might not even need a biopsy.
That's right. A biopsy is usually reserved for cases where the diagnosis is unclear or if we need to determine the severity of the liver damage.
Makes sense. But what if a biopsy is absolutely necessary? The text mentions something about a transjugular route. Why would they need to go through his neck to get to his liver?
That's a good question. Because of the fluid in his abdomen, going through the neck is actually considered safer in this case. They'd access the liver through a vein in the neck, avoiding going directly through the abdomen.
It's incredible how medical procedures can be so customized to each patient's situation.
It's all about choosing the safest and most effective approach.
Now, we've got a good idea of what's happening inside his body. But the texts also go into detail about the actual physical exam for ascites.
Ah, yes, the good old hands-on exam. It's still a crucial part of the diagnostic process, even with all our fancy technology.
What would the doctor be looking for when they examine this patient, and how would they go about finding it?
Well, the examination starts with simply observing the patient, and you might be surprised to hear that it begins with the doctor standing at the end of the bed.
At the end of the bed. Why so far away?
You can actually gather a lot of information just by observing from a distance. They'd be checking for things like jaundice, any unusual swelling, signs of weight loss, and even how the patient is breathing.
Wow, so much you can pick up just from looking.
Absolutely. It's all about paying attention to those subtle cues.
What about when they start the hands-on part of the exam?
They would carefully check his hands for things like clubbing of the fingers, examine his eyes for signs of jaundice or anemia, and even his mouth for signs of nutritional deficiencies.
So they're looking for clues all over the body, not just the belly.
Exactly. Ascites can be a sign of a systemic problem, meaning it affects the whole body, so we need to look everywhere.
I bet examining the belly itself is the main event.
You bet. They'd start by simply looking at the abdomen, checking for any visible swelling, distended veins, or unusual masses. Then they'd start palpating, which is basically pressing gently on different areas of the belly.
What are they feeling for when they do that?
They're checking for any tenderness, masses, or organ enlargement. They'd also use a technique called percussion, which is like tapping on the belly to listen for changes in sound.
Percussion, like when they tap on your knee with a little hammer.
Similar, but instead of a hammer, they use their fingers to tap lightly on different parts of the abdomen. The sound changes depending on whether they're tapping over fluid or a solid organ.
So it's like a musical way to diagnose ascites.
In a way, yes.
But how do they know for sure that the fluid they're detecting is actually ascites?
They use that shifting dullness test we talked about earlier. They have the patient lie on their back and percuss the abdomen, then have them turn on their side and percuss again. If the area of dullness shifts, it means the fluid is moving around freely, which is a classic sign of ascites.
That's pretty clever. It's like a low-tech imaging technique.
It's a simple but effective technique that's been used for generations.
So they're looking, they're feeling, but it doesn't stop there, right?
Mm.
They also listen to his belly with a stethoscope.
Yes. Auscultation, another important part of the exam.
What are they hoping to hear?
They're listening for bowel sounds to make sure everything is moving properly through his intestines. They're also listening for any unusual sounds, like bruits, which are whooshing sounds that could indicate a blockage in a blood vessel.
So they're using all their senses, sight, touch, and now sound.
Exactly. It's a full sensory experience, and it gives us a wealth of information.
But it's not just about the belly, right? They'd also check other parts of his body, like his neck and chest.
You're absolutely right. They would check his neck for swollen lymph nodes, which could suggest infection or even cancer, and his chest for any signs of heart or lung problems that could be contributing to the ascites.
So it's really a head-to-toe evaluation.
It's all about getting the complete picture. We can't just focus on one area. We have to consider the whole body and how all the systems are interacting.
Makes sense. And I'm guessing the grand finale of this whole examination is a rectal exam.
You guessed it. I know it might not sound pleasant, but it's an important part of the exam.
Why is that?
A rectal exam can help us rule out things like prostate problems or reveal any masses or tenderness that might be related to the ascites.
So even though it's uncomfortable, it could provide valuable information.
Exactly. It's all about being thorough and making sure we don't miss anything.
Okay, so after this incredibly detailed physical exam, are we finally done?
Not quite. We still have those blood tests, imaging studies, and a closer look at that acidic fluid to get through.
Sounds like we've got a lot more ground to cover.
We do, but we'll save those details for the next part of our deep dive. Stay tuned.
Yeah.
You know, it's amazing how much doctors can learn just from observing and examining a patient.
Right, like you were saying before, it's like old school detective work.
Exactly. But as we discussed, the investigation doesn't stop there.
There's always more, isn't there?
Oh, absolutely. The next step is to take a closer look at that acidic fluid. Remember that acidic tap we talked about?
Yeah, where they use a needle to take a sample of the fluid.
Right. So it's not just about getting the fluid out. It's about what we can learn from it.
So what kind of things are we looking for in that fluid?
First of all, they check out the appearance.
What do you mean?
Like the color and consistency. Is it clear, cloudy, milky, bloody?
So each appearance means something different.
Exactly. Cloudy fluid might mean an infection, while bloody fluid could signal a bigger problem like cancer or internal bleeding.
So the fluid itself gives us some initial clues.
Absolutely. Then they run some tests to analyze the fluid's contents.
Okay, so like what?
Well, we talked about the cell count, especially the white blood cells, which can indicate infection, but they also look at the protein level, which helps distinguish between different causes of ascites. And they'll check for things like electrolytes, glucose, even enzymes that might be leaking from damaged organs.
Wow, so it's like a full diagnostic panel, but for the fluid.
Precisely.
Okay, so we keep mentioning all these different causes of ascites. I'm starting to get them all mixed up.
Understandable. It's a lot to take in.
Can we do a quick recap just to make sure I'm following along?
Of course. Let's start with portal hypertension. It's basically high blood pressure in the portal vein, the one that carries blood to the liver.
Right, and that's often caused by cirrhosis, which is scarring of the liver.
Exactly. And cirrhosis itself has many possible causes: alcohol abuse, hepatitis, fatty liver disease.
Yeah, there's a whole list.
And that's why it's so important to consider all the possibilities. We also mentioned Budd-Chiari syndrome, where the veins draining the liver get blocked.
Right, and that can lead to portal hypertension and ascites.
Precisely. And then there's nephrotic syndrome, which is a kidney problem.
How does that cause ascites again?
So in nephrotic syndrome, the kidneys leak protein into the urine, and that disrupts the balance of fluids, causing fluid to leak into tissues, including the abdominal cavity.
So the protein is like a gatekeeper, keeping the fluid where it's supposed to be.
A great way to put it. And when the gatekeeper is gone, the fluid goes wild.
What about that rare condition, MIG syndrome?
Ah, yes. MEG syndrome usually affects women, involves a benign ovarian tumor, fluid buildup around the lungs, and ascites.
A trifecta of fluid issues.
Exactly. And the interesting thing is, removing the tumor often solves all three problems.
It's like they're all connected somehow.
It's quite remarkable. We also talked about protein-losing enteropathy, similar to nephrotic syndrome, but in the gut, not the kidneys.
Right, so instead of the kidneys leaking protein, it's the intestines.
That's it. And that also messes up the fluid balance and can cause ascites.
Okay, so we've covered liver, kidneys, gut. What about infections? Can they cause ascites too?
Definitely. Peritoneal disease, which is inflammation of the lining of the abdominal cavity, can lead to fluid buildup. Remember spontaneous bacterial peritonitis?
Yeah, that sounds pretty serious.
It is. But other things can cause peritoneal inflammation too, like cancer, certain medications, even autoimmune disorders.
So basically anything that irritates the peritoneum can cause fluid to leak out.
Precisely. Oh, and we can't forget about chylous ascites, which is a bit different.
Chylous ascites, what's that one?
This one's caused by problems with the lymphatic system, the network of vessels that helps drain fluid from the body.
And that fluid is milky looking because of all the fat in it, right?
Spot on. It's a unique type of ascites.
It's amazing how many different things can cause ascites. Really makes you appreciate how interconnected the body is.
It really does. And it's a testament to the skill of medical professionals who can sort through all these possibilities and figure out what's going on.
Speaking of sorting things out, remember all those blood tests we mentioned?
We can't forget about those. Blood tests are essential for getting a complete picture.
So, remind me, what are we looking for in his blood?
We start with a complete blood count, which checks his red blood cells, white blood cells, and platelets. Gives us a general overview of his blood health.
Okay, so it's like a basic blood checkup.
Exactly. Then we move on to liver function tests, which measure enzymes and proteins produced by the liver. This tells us how well the liver's working and if there's any damage.
Makes sense. And what about that AFP test we talked about earlier?
Ah, yes. The AFP test, crucial for checking for hepatocellular carcinoma.
The liver cancer, right?
Yes. And while we're at it, we also need to check his kidney function tests, which measure waste products in the blood.
To see if the kidneys are doing their job properly.
Exactly. And we can't forget about electrolytes, those minerals that play a key role in fluid balance.
Right, we need to make sure those are in check too.
Absolutely. Then we move on to imaging studies. Ultrasound and CT scans are the most common for ascites.
What's the difference between those two?
Ultrasound uses sound waves to create images, while a CT scan uses X-rays.
So they each give us a different view.
Exactly. Ultrasound shows us the size and shape of organs and any fluid buildup, and it can also assess blood flow through the portal vein.
What about the CT scan?
CT gives more detail about the organs and tissues like the liver, pancreas, kidneys, and intestines. And it's great for detecting masses or tumors.
Wow, so we're getting a really detailed look inside.
We are, and by combining the blood tests, imaging studies, and the analysis of the acidic fluid, we can really start to build a clear picture.
It's like putting together a giant jigsaw puzzle.
A perfect analogy. And the more pieces we have, the clearer the picture becomes.
And the closer we get to figuring out the cause of the ascites and how to treat it.
Exactly. Remember, the treatment depends on what's causing the problem. We've got lots of different tools in our toolbox.
So it's like we've gathered all the evidence, and now it's time to call in the specialist.
You got it. Each cause of ascites has its own specific treatment approach.
So it's not a one-size-fits-all situation.
Not at all. But before we delve into the specifics of treatment, let's take a moment to appreciate just how much we've learned already.
Yeah, it's amazing how much information we've uncovered.
And we're not done yet. There's still more to explore.
I can't wait to see what other clues we uncover in the next part of our deep dive. Okay, so we've spent this whole deep dive like a medical detective squad, gathering clues and analyzing evidence.
Absolutely.
Now it's time to put all those pieces together and actually treat ascites. It's not as simple as just draining the fluid, right?
You're exactly right. It's all about addressing the root cause.
Like fixing a leaky faucet, you got to find the source of the leak.
Exactly. So let's say our patient's ascites is caused by cirrhosis, which seems pretty likely based on everything we've learned.
Yeah, the clues seem to point in that direction.
Right. So the first step would be to manage the underlying liver disease as best as possible.
Okay, so how do we do that?
Well, it might involve lifestyle changes, like reducing alcohol intake if that's a factor, eating a healthy diet, managing other health conditions.
Probably the basics of healthy living.
Exactly. And medications can also help control some of the complications of cirrhosis.
Like what kind of medications?
We might use diuretics to help remove excess fluid and beta blockers to reduce pressure in the portal vein.
So it's a multi-pronged approach, targeting different aspects of the problem.
Precisely. But sometimes those initial measures aren't enough.
What happens then? What if the disease just keeps coming back?
In those tougher cases, we might need to consider more aggressive measures.
Like what?
One option is paracentesis, basically a larger scale version of the ascitic tap.
So they drain a larger amount of fluid.
Exactly. It can provide temporary relief from the symptoms.
But I imagine it's not a permanent fix.
You're right, it's not a cure. Paracentesis helps manage the symptoms, but it doesn't address the underlying cause.
So they might need to repeat the procedure multiple times.
In some cases, yes. It can become a bit of a cycle.
Are there any other options for those really tough cases?
Well, in certain situations, we might consider a procedure called a transjugular intrahepatic portosystemic shunt, or TIPS for short.
TIPS, okay, what's that?
It's a minimally invasive procedure where they create a shunt, a small passage, between the portal vein and the hepatic vein in the liver.
So it's like rerouting traffic around a blocked road.
That's a great way to put it. It helps bypass the damaged areas of the liver and reduce pressure in the portal system.
But I'm guessing there are risks with a procedure like that.
Of course, every medical procedure has some degree of risk. TPS can be effective in reducing ascites and improving quality of life, but it's not a cure-all.
So it's a decision that has to be made carefully, weighing the risks and benefits.
Absolutely. It's a case-by-case decision.
It's a good reminder that medicine is about finding the best approach for each individual patient, considering all the factors.
Couldn't have said it better myself.
Now, stepping back for a moment, we've been laser-focused on ascites.
It's been quite a journey.
But ascites is just one symptom, one piece of the puzzle. What other signs and symptoms might someone experience along with ascites?
So we're talking about the bigger picture.
Exactly. What do those other clues tell us about the underlying cause?
Well, the presence of other symptoms can really help narrow down the possibilities.
Could you meet examples?
Sure, someone with ascites from cirrhosis might also have jaundice, fatigue, loss of appetite, maybe some nausea, even swelling in the legs and feet.
So those are all signs pointing to the liver.
Precisely. The liver's not doing its job properly, so we see those other symptoms popping up.
What about someone with ascites caused by heart failure?
That would look different. They might have shortness of breath, fatigue, and swelling in the legs and ankles, more related to the heart's inability to pump blood effectively.
So the pattern of symptoms helps differentiate between different causes.
Exactly. It's like having a map to guide our investigation.
Well, I think we've successfully navigated the world of ascites. We've covered the causes, the diagnosis, the treatment.
It's been quite a deep dive.
It really has. We've learned so much about this complex condition.
And I hope our listeners have too.
Absolutely. But before we go, I want to leave our listeners with one final thought.
I always love a good takeaway.
We've learned that ascites is a symptom, a clue that something else is going on. So what other seemingly unrelated symptoms might actually be hints of a bigger health issue?
Encouraging our listeners to become medical detectives themselves.
Exactly. It's a reminder to pay attention to our bodies, listen to what they're telling us, and never hesitate to seek medical advice if something feels off.
Wise words. We've all got to be advocates for our own health.
Well, on that note, we'll leave you to continue your own explorations into the fascinating world of medicine.
Stay curious and keep learning.